Good afternoon. We are almost at the end of today's conference of IPA Con 2024 AP and Telangana chapter. Today we are with us Dr. Varun Vishwanath, is a consultant plastic surgeon in Warangal. Sir, actually, just before the lunch, you were sharing a session on the advanced wound care and the wound closures, primarily with effective collagen. And I was very interested to note that you are talking about that combination
Dressing
use.
part. Yeah, combination part.
And for your information, Vishwanath is the first who started using collagen fiber and collagen particle, collagen gel, to be precisely Curo gel and Curo fiber in different combinations for his patients. So today I'm here to know your experiences about these products and why you use this combination, how it is benefited to your patients.
So, yeah, the combinations, the gel and the collagen, it works very wonderfully. It's like for different kind of patient wounds, I should say, it's the wound factor which decides how better we can use the product and also what benefit and how beneficial it is for a patient. So if the wound is lot exudative, lot of exudate is coming up, discharge is more, where I prefer in the combination, the more of the collagen fibers along with the gel, it's like a 1:2. Gel is like one portion and go with the more of collagen and then do the dressing part. So as we do the dressing a day or 3 or 4, and then slowly once the exudate decreases, we go on to 1:1 proportion, and it has a lot of wound healing. Very good wound healing is there. And one more important factor which I feel is the pain factor.
Yeah, that is what I've asked you. So you actually use a lot of collagen composition available in the market.
True.
And how you feel when I remember we had a lot of discussions regarding you asked me why I should use yours products.
True.
What is there for vitamin C? So
True.
now I think after 6 months. What is your experience? How do you find it's really different from others, or it's the same? What's your
No,
experience?
it is definitely a good product, and the healing part, it actually taking like in a 2 weeks almost majority of the wound heals up. So most of the infection control, the first criteria for wound healing is you need to control the infection. Infection comes down, exudate comes down, healing it gets promoted by the collagen. So all the wonderful things happen if correct dressing is done and the correct product in mixture. So for a wound which is exudating a lot, you're putting more of the gel, you're providing hydration. Okay, that kills up the bacteria and all those things. But for the fibroblasts to come to the site and to increase the, you
So
need
you
to
want to add that
fasten.
Curo fiber?
Curo fiber should be added.
Okay.
Curo fiber should be added so that the wound healing is much more quicker.
Much more. In fact, we are got the same feedbacks. Where they have used the combinations, the onset of action is much faster. The
True.
closure of cavity is much faster.
True. So 1:1 combination, 1:2 combination can be liberally be used depending upon the wound and even the pain factor. What I feel, so diabetic wound is there or any other chronic wound, the entire wound may not be painful. Some part of the wound is little bit much more painful. So once you do, a few people just don't do dressing or just apply the gel. So closed dressing, I prefer a closed dressing. So you put up the gel, you mix up the combination of the Curo fiber, Curo gel, mix up, and then you keep the dressing closed. So what happens? First point is like patient pain decreases, so it's not exposed to external thing and also prevents any other external trauma to it.
Trauma.
Patient is comfortable with the closed dressings. Daily routine activities and daily things he will be able to attend, and daily dressing is required. So I feel collagen with the fiber is a good combination. And very
But
much-
means Curo fiber with the Curo
yeah,
gel.
Curo fiber and Curo gel, they are very good. I've seen the other gel forms also, which are actually gel, but when put on the skin, immediately it's melt down like a liquid. So that doesn't happen with the Curo gel, which I've observed. It's a good product. It stays on to the wound.
Thank you, sir. Sir, any message? Just one question I would like to ask. We are always trying to create the difference.
Okay.
On the products, we try to add values. And recently, I think you have also experience. You have recently launched this Curo Skin D which is a polymeric collagen membrane, we say. It has a hydrocolloidal property and 100% non-hydrolyzed collagen. So primarily for superficial wound, we are saying this. And it has also has an excellent absorbable hemostatic property. So definitely, sir, do you think is when there are wound is a hyperproliferating already, is there any scope on that cases?
So this one, it depends upon the infection rate also. So hyperproliferating, sometimes it's too much going on, it may require little bit surgical intervention also.
Exactly.
And then followed by the dressings part.
Maybe topical steroid could be a good option. Thank you, sir. Thank you very much, sir. Any feedback? How do we improve better?
Sure.
Any feedback if you can give me on which part we should work more?
Sure. It depends. Right now you have a quite good product regarding this Curo fiber and gel form. They are quite good. Only thing is the combination part. So one thing good thing that you have separated the fiber and gel is like gel also can be used in superficial abrasions, and it gives quite good healing. It has nano silver also, so it gives a quite good feeling. It heals well, and patient also main pain factor you are cutting off the pain factor, so it's good for. In my overall view, it's the good product.
In fact, I was seeing that Dr. Sir, Regional Sir is also showing some of the burn cases where he has used the Curo gel and patient got relieved within almost 1 week.
True. Burns is a very painful condition, and pain actually starts because of this pain only when the patient comfort level, the diet part, everything is related to pain. So gel form provides hydration, controls the infection, and definitely a quicker wound healing.
Okay.
So that's it.
Thank you, sir. Thank you very much to Dr. Varun on behalf of Quorit Academic Foundation.
Thank you.
Wish him all the best.
Thank you,
sir.
Thank you.